People who are the best at what they do get there because they know when to ask for help.
Yeah, teamwork is especially important in the medical field, where one patient may require many specialists to help them. In today's MedWatch report, Michelle Dunaway shows us the role local doctors play even when a patient is hundreds of miles away.
We're just grateful for every day with him. It's been a lot of fun being new parents and just watching him grow and learn, and yeah, it's been the best.
Like most new parents, Rachel Jones and Aaron Jenkins are over the moon about their new addition, Keenan. But they have even more reason to celebrate this young life after he nearly died.
We noticed that Keenan was having some difficulty breathing, and so we called 911. He was admitted into the ER, and when he got there, he went into a severe respiratory failure. And at that time, the ER team performed CPR and saved his life.
And because he wasn't breathing, his internal organs were failing because of that. And so our job was to place a breathing tube so we could help him breathe for him. And once we were able to breathe for him, then his organs started to work again.
Yeah, it was incredibly scary and traumatic. We were in the waiting room with our family, and the staff they're really honest about that they didn't know what the outcomes were going to be.
Dr. Matthew Arnold and the rest of the team at the Munson Medical Center Neonatal Intensive Care Unit got Keenan healthy enough to move him down to the University of Michigan.
We realized he needed a higher level of care because we didn't know why he stopped breathing. And because of some of the organ failure, we thought he needed some subspecialists to round on him and to provide their input because we didn't have an answer.
Keenan spent 5.5 weeks at the C.S. Mott Children's Hospital in Ann Arbor, but he was still very much on the minds of everyone here.
Something that really touched us is when we were in Ann Arbor that Dr. Arnold just continuously followed up. He would call Keenan's lead doctor in Ann Arbor and ask how he was doing. He called me at one point. You could just tell that he really, really cared about his outcome.
Good to see you, pal. Oh, hi, Mom. How are you? Good to see you.
And today, Rachel and Aaron still keep in touch with Dr. Arnold months after Keenan's release.
We love to hear from our families. And so I think this was a traumatic experience for them, and the fact that Keenan's doing so well is amazing.
And you can be sure these new parents aren't wasting a moment with their miracle baby boy.
Yeah, we got some visitors.
We had such a huge level of support and compassion, and so it really inspired me to try to show up for other people in need. And I hope to also model and teach that to Keenan. He's made a pretty big difference in a lot of lives already in his short time, so I think he'll continue to do so.
For MedWatch, I'm Michelle Dunaway.